Today is, excuse me, Thursday, May 9th. This is a regularly scheduled
This
meeting.
conference will now be recorded.
This is a regularly scheduled meeting of the Central Nevada Health District. And I call this meeting to order. Our first item of business is the Pledge of Allegiance. Please join me.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Roll call.
Chair Ken Tedford, Justin Heath, Bob Erickson,
Present.
Denise Ferguson, Tyson McBride,
Here.
Larry Rackley,
Here.
Jeb Rowley, Rich McKay.
I'm here.
Okay, thanks.
Sorry.
Yeah, that was Jeb. Rich McKay, Don Witten, Pete Olson,
Erickson.
Tina Manzini.
Ferguson. Hi, Tina Manzini, here.
I counted 6, and Tina was just sworn in, so I think a quorum is
So
present.
we do have a quorum.
Yes.
Thank you. Public comments. Public comments and discussion. All items raised under public comments are, no action can be taken on them unless they are placed on an agenda as an item upon which action will be taken. Public comments will generally be limited to 3 minutes per person. Public comments. Identify yourself, please.
Good afternoon. For the record, Bob Clifford from Fallon, Mr. Acting Chairman and board members. I've provided a handout, and also there's an electronic copy with lots of links to alternative news articles about COVID vaccines and closely related topics, largely about their deadly effects. There's some big news very recently. Japan has banned all of these mRNA vaccines completely after decision based on excess deaths and all kinds of scientific work that they did. Injured people there are not being ignored. Here, vaccine injury just gets shoved under the rug. AstraZeneca has pulled their vaccine off the market worldwide. They had a little class action lawsuit in the UK, about 81 people that were killed and hundreds that were severely injured. And shortly they claim that the decision to withdraw, it's not related to the lawsuit, but the timing is kind of suspect. And now renowned scientists, several, who have particular expertise in this area, that everyone that got the vaccine is going to be dead within 5 years. And they have the scientific background to support that. And the latest that has come out is that the vaccines cause the production of prions in the body. Prions are the kind of thing you get in mad cow disease. They will cause dementia, at least dementia. So now we've got to have a pandemic of turbo cancers and dementia. And the prions produced are contagious, that can be passed from the person that has them to an unvaccinated person, putting everybody at risk. So this is a pretty interesting scenario. In Australia, the data shows that 25% of the vaccinated children are, they called it, I think it was damaged or something. It looks like 1 in 25 children that got the COVID vaccine have autism. 1 in 25. That's an extremely high rate of autism. So you won't hear about these things. The media won't cover them. They're beholden to big pharmaceutical advertising. The CDC and the FDA and the federal government are corrupt, in my opinion. And there's a lot of data to support that. If you read through all those articles, you'll see all the cases where they lied, withheld information, et cetera. You can't trust them. The other thing that's also become clear is that the government recommended treatment protocols for the hospitals that were basically killing protocols. They wanted to boost their death numbers for COVID so they could scare people into taking the vaccine. In the United States, they use Resmetiver. A lot of patients died of kidney failure because of that. That never should have been prescribed. They had effective drugs like ivermectin, which they couldn't acknowledge. If they did, they wouldn't be able to have their vaccine under the law. And then in the United Kingdom, they use midazolam, which I don't know much about, but that also had a similar effect over there. They also withheld nutrition and water and hydration, and basically it was a killing protocol, and that's evil. With another election coming up, conveniently, a new threat has emerged. You've probably heard about a bird flu variant, H5N1 variant. Amazingly, they already have vaccines in volume production. Amazingly. A Bill Gates insider whistleblower that used to work for Gates said they're planning to kill 2 or 3 billion people with that vaccine. How convenient, especially if they're going to try to steal another election. So I urge you not to trust anything you hear from the FDA or the CDC or the NIH or Pfizer. Anybody. They've all been caught lying and withholding information, refusing to disclose information, redacting stuff that was incriminating against themselves. So they, none of these guys, they're all on a depopulation agenda to save the planet. Don't be part of it. And with this new bird flu coming around, it's going to be interesting, but I would expect to see mandates and things, and I think the people have to fight that and not accept that type of thing. It's unconstitutional on top of everything else. Thank you very much for your time. Appreciate it.
Thank you. Any other public comments in the room? Public comments on Zoom? Hearing none, or seeing none. Verification of the posting of the agenda.
Amber Edwards, for the record, verifies that the agenda for this meeting was posted on the 3rd day of May 2024 between the hours of 3 and 5 p.m. at all of the locations listed on the agenda.
Thank you. Item number 6, consideration and possible action, approval of minutes of the meeting held on April 11th, 2024.
Mr. Chairman, Bob Erickson for the record. If no one has any additions or corrections to minutes, I would move approval of the minutes of the meeting held on April 11th, 2024.
For the record, Don Witten, I second that motion.
We have a motion and a second. All those in favor? Aye.
Aye.
Motion passed. Item number 7, appointments. Consideration and possible action, reference approval of the notice of a subaward between the Public Health Preparedness Office, Bureau of Health Protection and Prevention, and the Central Nevada Health District in the amount of $1,351,059 for the period of July 1st, 2023 through June 30th, 2024, to support the district and to improve data collection and reporting of test results. Mr. Winkleman.
Mr. Chair, members of the board, for the record, Darren Winkleman. This is one, if not the largest grant that we have with the district. And really, bottom line is this grant is to support everything we do. From just the day-to-day activities, has a lot of, kind of the travel that's built into that, the support that's built into it. The drawback to this particular grant is, obviously, we're just bringing it to you today, but fortunately, we are retroactive back until July 1. And so we're working diligently to work through those requests for reimbursements with the state. We've made a few adjustments in terms of the percentages we have based on the salaries, and the state's given us approval for that. And so we're going to be working the next couple weeks, 3 weeks, to make sure we get those retroed, get it caught up. So with that, I'll turn it back.
Good, thank you. Ready for a motion?
Mr. Chairman, Bob Erickson for the record. I had one question. Is this grant renewable in future years, Mr. Winkleman?
For the record, Darren Winkleman, yes, at least for the going into FY '25. It's our understanding that this grant will continue level funded. Past that, we're not sure.
Thank you. Then I'd like to make a motion to approve the subaward between Public Health Preparedness Office of the Bureau of Health Protection and Prevention and Central Nevada Health District in the amount of $1,351,059 from July 1st, 2023 through June 30th, 2024, which will support the district and improve data collection and reporting of test results.
For the record, Dawn Witten, I second that motion.
We have a motion and a second. All those in favor of the motion, vote aye.
Aye.
Aye. Motion passed. Number 7B is consideration and possible action reference approval of the interlocal agreement between the Central Nevada Health District and Churchill County regarding supportive and health administrative services from July 1st of 2024 to June 30th of 2026 in the amount of $81,698 for the period of July 1st, 2022 to June 30th, 2025, and in the amount of $103,838 for the period of July 1st, 2025 to June 30th, 2026. Mr. Winkleman.
Mr. Chair, members of the board, for the record, Darren Winkleman, as you know, we contract with Churchill County for some of the services for the district right now, which include information technology, the comptroller's office, legal services. Thank you, Jeff. Clerk treasurer. I think I'm missing one in there yet. And those are for just the basic services that we need to kind of operate. The other one is HR services as well, so we can get people hired on board. So they've agreed, the Churchill County has agreed to keep the agreement the same as last time at the $81,698. And then moving into FY '26, looks like we'll be changing that a little bit to the $103,838 based on calculations of the positions within those particular agencies. And then again, at the end of that year, we'll bring that contract for renewal or again for review to the board moving forward.
Thank you. Any comments from the board? I would entertain a motion.
Mr. Chairman, Bob Erickson, I'd like to make a motion that we approve the interlocal agreement between the Central Nevada Health District and Churchill County regarding supportive and health and administrative services from July 1st, 2024 to June 30th, 2026 in the amount of $81,698 for the period of July 1st, 2024 to June 30th, 2025, and the amount of $103,838 for the period of July 1st, 2025 to June 30th, 2026.
For the record, Dawn Witten, I second the motion.
We have a motion and a second for approval. All those in favor of the motion?
Aye.
Motion passed. Okay, moving on to item 8 of the agenda, and that's staff reports. Dr. McDonald. You are the staff.
Good morning, board members. I am the staff, Dr. Ted McDonald, for the record. And in your packets, you have reports broken out into each separate county. Reason we're trying this and moving to this is because we will be doing presentations in the other counties and would like to be able to have it set up so that there's a focal point for those communities. On the 15th, we will be going to Mineral County and are on their schedule to be heard. And so if they have questions in particular, we'll be able to break it out specifically. The other aspect of this is there are 4 different reports in here. There's clinical services, environmental services, emergency response, and epidemiology. And that gives things broken out a bit so that people realize that we are not a clinical service. We're not your community health nurse, even though we serve that purpose. We are your environmental specialists, we're your epidemiologists. In some communities, that's going to be a bigger part of our service and more bang for that community's dollar, really, is what what we're seeing with this. And it's hard breaking from the old system where all that really was heard or seen was the community health nurse. We're also finding that we are going to be a lot more mobile than what the state has been in the past as far as being able to get to communities, to be able to respond to them. And that's part of our mandate right now internally is that we're very responsible, we're very responsive, and if we have to go out of our way to get something done, it's like we will drive from Fallon to Eureka and get things taken care of if the need is great for that. I'm happy to answer any questions here. The other thing is you are not probably going to see very much on our website about respiratory diseases, and that is because I believe May 15th, the reporting period is over for them. There will still be throughout the communities and throughout the nation a network of labs and hospitals that will still report or investigate any unusual increases in respiratory illnesses. We're expecting our next reporting period to start in October, so we're not done with that at this point. The other thing is that just received notification from the CDC that for those who are 65 and older are now eligible for their next COVID vaccine on there. So that is out there now. So that is there, and it's up to everybody to determine what their risk factors are and if it's appropriate for themselves. Any questions? I'll keep this short.
Any questions for Dr. McDonald? Anybody on Zoom? Didn't appear so. Thank you. That brings us to item 9.
Mr. Chairman, if I
which
may,
is- Oh,
may real quick,
yep,
jump in there real fast?
yes.
Thank you. For the record, Darren Winkleman, I just wanted to give you an update as well in terms of some of the events we've had over the last month. We have attended the Wellness Expo in Hawthorne, and super great attendance there. I think the district was well represented, so got to see a lot of people there. We also did the Pinwheels for Prevention year in Churchill County, City of Fallon area. An amazing turnout there, super supportive of what Churchill County Social Services puts together there, and I'll give Brittany a hand of getting all that squared away. But they did a great job, and so we were pleased to be a part of that. And just so you know, May, we're going to start all of the needs assessments, the infrastructure needs assessment with the Nevada Association of Counties. We'll be in Pershing County on Monday to kick the first meeting off, and then, I don't know the dates from there, but we'll be headed up to Mineral County, then up into Eureka, and then one here in Fallon to do that as well. So that keeps a busy month of May for us, and trying to keep it all running and then do those events as well. And so it's just kind of an update of where we're at. Want me to go ahead? The other one we did was the Meet Your Inspector here in the city of Fallon that Maria put together, our environmental health manager. I think she did a great job with that. We had, I thought, a tremendous turnout for the first one we've done. That was to just give a little bit of information about what we do and how we interact with some of the facilities within the district and what they can expect. We hope to do that. I think next one is in Pershing County. We'll be moving to Mineral County and then ultimately into Eureka to do those events as well. I think it goes a long ways to develop that partnership, and that's really what we are here to do, is to develop that partnership. And so we hope to not only do the ones moving forward, but then kind of on an ongoing basis and in certain specific topics as we move forward. And if people want to learn about, the proper way to wash your hands or why we wash our hands, those sorts of things, we would like to do that moving forward as well. So super successful, and appreciate you guys' support on that. So that's it.
That's it.
That's it.
Thank you. Any questions for Mr. Winkleman? Okay. That brings us to public comments. Uh-oh. Public comments and discussion with somebody's coming up.
Good afternoon, Mr. Chair and members of the board. Shannon Ernst, Churchill County Social Services. So as I was looking at the agenda and the data, there was a few things that came up, and so I thought this was a really good time to come in and just give an update what we're doing here in Churchill County to address some of the concerns. As you know, in 2023, we did our community assessment, which is now leading into a strategic plan. Within social services, our strategic plan looks across the board. So it's our aging and disability, it's looking at health services, everything in those matters. But one of the biggest things I wanted to announce is the Churchill County, the lab was previously a satellite lab with the state, It has now become a Churchill County Rural Public Health Lab. The whole goal with doing that is we're going to serve all the rural areas to help meet the needs of the lab services, which was one of the things identified in another plan that I'm going to talk to you about. So that has launched. We do have a courier service that is going to be available 5 days a week to meet the needs of the communities. Next week, we'll be having letters delivered all the way from Lander County all the way down to Mineral, showing what our availability is, how do you access that. We launched our new route manager so that we can be live entering in specimen requests so that those get picked up. If there's anything that we cannot actually process, we will give the option that we'll take it to Reno for them, because this has been a concern since the beginning of pandemic. How do we get things across the rural areas in a timely fashion? Dr. Alex Snognoff is our new doctor oversight. So we're very excited. We go through our new process for our CLIA, for our name change, new doctor, and we're adding 5 new test samples June 6th. So we're just going to continue and expand. Within your health data, there was quite a bit of concern looking at, in Churchill especially, our overdoses. As many of you know, we've been working on our opioid use and misuse needs assessment. This is required by the state that this be completed in order for individuals not only to spend the opioid settlement dollars that are coming to each county, but it's also required that any nonprofit or anybody that wants to apply to the state settlement dollars, that they have to utilize this plan. And Michelle Fullhauer actually is here with me because we have a meeting after this. It was her and her group at Winged Wolf that got this completed. It will be able to be accessed on our website, but also you're welcome to have a hard copy if you would like to read this 220 pages. But there's great recommendations. As Churchill County moves forward, we're going to go internally and look at the recommendations on what we can implement and then what we can work with our partners on. The last thing is looking at our suicide data that was also reported. Churchill County Social Services partnered with the Churchill County School District and the state of Nevada to start our behavioral health intercept model and suicide reduction plan. This kicked off last month, so we've had a large amount of partners around the table talking about where are the intercepts for individuals with behavioral health issues, how can we reduce our suicide numbers within our county, and so we'll be coming out with different recommendations. So just thought this was a good time to let you know as you see those data trickling, and I'm excited to see those numbers actually being reported and the conversations happening. And if there's anything we can help with in the future, please let us know. We're partnering closely with the Central Nevada Health District to do a lot of outreach and other programming as we find it fits. Okay, thank you.
Any other public comments in the room? Any public comments on Zoom? Seeing none, we have gone through our order of business. This meeting is adjourned.